I'm Christy Strauss, and I am here today with Shannon Burney, and she is the account executive at Ambetter. And Shannon's going to provide us a really nice, robust webinar and slides showing us some really neat things, why you would choose Ambetter, kind of position it for us, why we would use this carrier versus another carrier, and then just show us all the really nice benefits that these plans have. So Shannon, thank you so much. And I'm just going to let you take it from here.
Fabulous. Thank you so much, Christy, and good morning to everyone. Super excited to be with you here today. Like she had mentioned, I have a pretty brief overview of things that I'm going to go through, hopefully answer everyone's questions. If I don't, please put them in the Q&A and we'll get to them at the end of the presentation. A good follow-up for this as well is we do have a recorded version. Although it won't be as good as me going through it live today, if you do have any additional questions afterwards, we'd be happy to share that link, and they're recording it for your agency as well. So with that, we will go ahead and get started here. Welcome everyone to Ambetter Health. We are a certified qualified health plan on the health insurance marketplace, or the state-based exchange. And we are America's #1 marketplace health insurance, something we're very proud of. 1 in 7 ASA shoppers choose Ambetter Health. So great stat there. I always share it with all my brokers. Likewise, feel free to share it with your members. It's a company and a plan that members can trust in. Granted that so many shoppers choose us when deciding between. On that same note there, we have over 3 million members and counting. I believe we're at 4 million, so that should be updated after this last open enrollment and growing. So well over 4 million that we've added since this last OEP for total. Our plans are designed to deliver high quality, locally based healthcare, and we were established in 2013. We have 28 states across the country that we offer our coverage. A nice call out here, if a member is enrolled in our EPO or core plan, which in Michigan is the only plan that we offer, members can cross state lines. So if they'd like to go see another provider in another state, so long as they're visiting an in-network provider that's on our core plan, they do have access to care across the country in any state that we offer our coverage. We are offered by the Centene Corporation, Fortune 25 on the list, and we have over 30 years of experience in the managed care industry. Basically what this saying is Ambetter and Centene is someone you can trust. We've been in the market for quite some time, so we have a lot of experience to be backed on. As far as expansion this past year, we've added Delaware. Small state, but if you do have options or people there that you'd like to enroll, please feel free to reach out. We can get you appointed in that state. A few overarching updates. So our Ambetter telehealth is now virtual 24/7 care. We'll touch on this later in the presentation. We also have our member quick reference guide. We'll touch on our member portal in a little bit more detail, but this is digital now for members to access. If you're familiar with Babylon Health, which we had last year, we are no longer using that. So the provider for our Ambetter virtual access care will be telehealth or teledoc. We'll also touch on this later in the presentation. And the virtual 24/7 care, or this plan, is available in these states mentioned, Michigan being included. We'll also touch on it later in the presentation here. All right, we're going to go over some of our plans, portfolio, and benefits that we offer. Starting off with the network highlight, that being Henry Ford Hospital. So a great partner. I know we added them recently. A great expansion for members. So feel free to share this when members are deciding between a different network. It's a strong provider that we have on our core network. As far as our portfolio, we have 4 gold, 4 silver, and 4 bronze for Michigan. All of these plans have the vision and dental offering. Our lowest premium bronze is our standard expanded bronze. Lowest premium silver is clear silver, which we'll touch on. Lowest premium gold is standard gold, and our lowest copay plan is our focus silver. Highlighting our focus silver, this is our lowest cost silver plan that includes copays for PCP, specialists, lab, urgent care, and generic RX. For the purpose of the presentation, I'll focus on the 94% AV level there to the far right-hand side. You'll see the deductible is at $0, max out of pocket at $13.50, coinsurance at 30%, PCP visits a $0 copay, and preferred generic and generic RX are at a $0 and $0 copay. Next up is our Elite Bronze. We have copays on this plans for office visits, generic, preferred prescription, and an overall $0 deductible. The max out-of-pocket on this will be $9,250. PCP visits will be a $45 copay. Specialist visits will be a $115 copay, and preferred generic or generic RX will be at $3 and $35 copay. Now on to our gold offerings. Our complete gold has a deductible of $1,450, max out of pocket at $7,500. Coinsurance will be at 20%. PCP visits will be at a $15 copay. Our preferred generic and generic RX will be at $3 and $15 copay. Now on to our Elite Gold. Deductible will be at $0. Max out of pocket will be at $5,500. You'll see a theme with our plans. Telehealth and virtual care will be no charge. So that is true for all the plans that we offer. If they're going through Teledoc, it will be no charge if they would like to seek virtual care. Specialist visits on this will be a $60 copay, and preferred generic RX will be at a $3 and $15 copay. So now that we've highlighted our core EPO plans, we're going to focus on our virtual access portfolio. So again, this is available in a limited amount of states, Michigan being one of them. We have one for the gold, silver, and bronze portfolio. It's important to call out for this plan. It's designed for members who desire more virtual primary care experience. So they will have to select a virtual PCP, and members on this plan should not expect to keep their current in-person PCP. If they'd like to go to an in-person PCP, they will need to first establish the virtual PCP and then get a referral to go see an in-person. There's a little bit more of a portfolio overview for this plan that we touched on. So again, very important call out here. It's not designed for members who'd like a traditional in-person. If they'd like to go brick and mortar, they can receive a referral to pay a copay to go in person. What's nice about this plan, it does have unlimited $0 visits with their virtual Teledoc PCP. And another call out here as well, no vision or dental buy-up that will be offered on the virtual access portfolio. Now we're going to highlight our vision and dental add-on. Members do need to be 19 years and older in order to have this added on to their plan. Another important call out is you do have to select the plan at the time of enrollment with the vision and dental add-on. You cannot add it on at a later time after they've been enrolled. Routine eye exams is one visit per year at a $0 copay, and eyeglasses or contact lenses in lieu of glasses are covered up to $130. Next up is our dental. Same deal here, members have to be 19 years and older. It's $1,000 per covered person per calendar year. For any routine dental or class 1, it's covered at a $0 copay. And for basic dental or major dental, class 2 and class 3, it's covered at a 50% coinsurance. What's nice about this is it's no waiting period. So feel free to share that with members if they're deciding to choose the add-on. We also offer off-exchange plans in Michigan. So this is ideal for consumers who maybe don't qualify for a subsidy, but are still looking for an affordable premium compared to an on-exchange plan. What's nice, it's the same exact provider network and formulary, and some of the plans will include low deductibles, primary care and specialist copays, and copays for generic and preferred medications. You'll see that screenshot there to the right-hand side. If they are going through the enrollment, they'll have to select that no option to then be presented with the off-exchange plans. All right, we're now going to highlight our broker portal. Hopefully you're all very familiar with this, but if not, we'll go through it step by step here so you can see exactly how to use it. If you can't get logged in, feel free to contact myself or our broker sales support team. Their number is there on the screen. We'll also have it at the end of the presentation, but they'll be more than happy to help make sure you get logged in here. We also have a quick reference guide, so anything that we go over here in the presentation, we'll also have available in your portal to go ahead and access this quick reference guide in the portal. All right, so here's a snapshot of what the homepage will look like. A lot of information. We'll dive into each of it a little bit in more detail here so you have a better understanding. But what you'll see is total active members, delinquencies, and unpaid binder payments on that dashboard right there. And at the top of the screen, we have some different options for you to sort through. So that's policies, commissions if you're principal, sub-producers, resources, and a couple other things that we'll touch in on these folders here. All right, we're going to go ahead and select policies, and this will bring you to this dashboard here. What's great about this is all of your members will be accessible for you to manage. So once you enroll a member, it would probably take 2 to 4 business days to load to your portal, and then all of their information will be here for you to easily access. You'll see we have the term date, paid through date, as well as a policy number and your broker name to show that you're assigned to that policy. A nice thing here to the far right-hand side in that circle labeled number 3, you can actually export this into an Excel spreadsheet. So if you'd like to take your members outside of the portal to manage, feel free to utilize that tool there. All right, we're now going to go into a sample policy here under member details. So again, a lot of information. I'll break it down here for you. You have the policy number as well as the monthly premium, the tax credit, and member responsibility. We highlight their plan name, as well as if they have dependents on the plan. Something very nice about our broker portal is you can order the ID cards, whether you save it and send it to the member, request by mail, print, or can save to the Apple Wallet. A couple options there to get them their card if they need it. Another nice feature that we've recently added is our My Health Pays. So we'll touch on this later in the presentation, but amazing plan and benefit offer that we allow for members to use. So we'll actually show if they're enrolled here, and if they are enrolled, we'll show how much credit they have or that they've earned to use towards healthcare related costs. Something else that's not highlighted here, we do have an age-in policy. So this will be a separate tab. If you do sell Medicare, we'll actually show you which members are getting close to 65 that you could have from the ACA side to keep as a client and move over. So we do have a column there that I'll call out here so you can easily keep those members on the books. So a couple of key reports here. As we all know, having members pay their binder payments and premiums is very important to keep them active. So we make sure that's very easy for you to access here. So again, we do highlight the paid through date as well as a member responsibility. We also have filters for delinquency and unpaid binders. I recommend to all my agents to go through this weekly to make sure all members are up to date, to make sure that they're paid so that you're paid. For delinquencies, again, we have that tab that you can filter through. We do call out how many days they're delinquent. For this example here, 60 days, and we also show what the current balance is to go ahead and bring them active. You'll see highlighted that quick pay there. Super easy option if you'd like the member to quickly get up to date and be active. They can pay as a guest. So a couple of information slides there they'll need to fill in, and then they'll be all set to quickly pay and be brought back active. Back in the unpaid binders here, we also have that filter as well as the paid through date. You'll see is blank because they have not yet paid. Make sure, as you all know, members have that 30-day from effective date to go ahead and pay their binder payment. So again, very simple option for there to go ahead and set up that quick pay if they'd like to get it submitted. We recommend that all members do enroll in auto pay so that they're staying up to date with payments. But if you'd like to help them quickly get it submitted, you have that quick pay option at the top of the portal. The far right-hand side, which we just touched on here, we have that quick pay, but a couple other things that you can easily access. We have Enroll a Client Now. So this is our Health Sherpa, our Ambetter's Health Sherpa. You do have access to it as an agent with us. So it will show only Ambetter plans, but for any agent who'd like to have access to Health Sherpa, we give you a free login there. So feel free to easily access this link through Enroll a Client Now. And then our Find a Provider or our guide search, which we'll touch on here shortly, but an easy tool for you to quickly select it if you need to look up a provider, whether or not it's a network. All right, we're now going to highlight our resources, FAQ, and communications. So frequently asked questions, we'll have that loaded there. Feel free to take a look. If you have a question that you think another agent might have asked, it might be underneath that section there. And then email communications, anything that we send out to brokers, we will load this here to the email communication as a PDF. All right, under our resource tab, we have a couple of different folders. One being forms, so we are accepting broker releases or contracting changes at this time. That's where you could access those sort of things in that form folder. Training materials, we have tutorials such as this that you could easily access if you'd like to look back into information, plan information, and other reference guides. Our marketing materials is a great folder. It has state-specific marketing materials, our social media guide, and these are all pre-approved for you to use. So feel free to take a look in there. A lot of helpful social media posts and sample text that you could easily copy paste and go ahead and post as far as marketing. There's a deep dive into our training material folder. So you'll see we break it down by state specific, and then we have a lot of general helpful materials. So the broker portal guide will be underneath this section here. And then our training grids for our plans, whether it be the vision and dental or core plans, will also be available in the training material folder. Like we mentioned, our marketing materials, this is that next folder. It is broken down by state, so you'll have pre-approved flyers for each state. And then our social media guide, I do strongly suggest taking a look at this. It's a little bit of a lengthier guide, but it has a lot of information in there. And again, very easy for you to go in there, copy paste some of the posts, and blast it out to social media. All right, we're now going to highlight how to edit your user profile. So I like to go through this. Some agents aren't always aware how to get to it, and sometimes it can be a little tricky. So we'll go through it step by step. You should see your name to the far right-hand side in that top pink banner, and you'll select My Profile. This will then bring you to this page here where you'll see your user profile as well as your dashboard and a few other things that we'll get into here. So first off, the information at the top. Please note you cannot change this or edit this from your user profile, but you could reach out to me or our broker support team to get any of that information edited, whether that be phone number, email, or address. Another important call out is towards the bottom of the screen. You'll see applications and progress applications, license, and contracts. The contract will show you exactly where you are appointed and active with us. The license column will show you where you're licensed, but please note this does not mean you are active with us in those states. Please reference the contract tab, and that will show you exactly where you're all set to sell with us. Let's say you're looking to add on a new state like Delaware, for example. You can go to in progress applications, and this is where you can easily access those contracts to go ahead and get completed. Just a quick overview and tips of reminder of what we covered. It's very important to leverage your dashboard. You have a lot of helpful information with all of your members' information, ID card, payment, a lot of helpful tools in there for you to use. Like we talked about, the broker communications will be posted, as well as any FAQs, marketing materials, or resources are available for you at any time to access through the portal. All right, next up, we're going to highlight our Ambetter guide or our network search. So this is what it will look like when you get to the guide search. The URL is guide.ambetterhealth.com. Again, you can easily access this through your broker portal or through our general website, Ambetter Health. We do recommend if a member has their login information, this is the easiest way for them to get the most accurate results. We will show them the network that is related to their plan and their information coincided exactly with the network or providers that they're looking for. So we do recommend if the member has this, feel free to log in. But if not, that's no problem at all. They can go ahead and search without logging in their home state, member ID, or last 6 digits of the social security number. It will prompt you to select the state, coverage year, and county. Once you've selected that, you'll have to choose a network. So for Michigan, it will show the bronze, silver, gold, as well as the virtual access. Here's what our guide search will look like. If for any reason you need to edit, whether it be the state or network year, there is an option at the top there. Pop up a screen like this, and then you can easily go ahead and change whatever you need to for the search. For this example, we're going to search for PCP in Miami, Florida. So this is what the results will look like, mapped to the right-hand side, results to the left-hand side. So some nice information will show you if you're quickly searching through to see maybe the closest provider. But if one of them seems like a good fit, you'll go ahead and select View Profile. From here, you'll be able to see the provider's name, if they offer virtual visits, and their telephone number. You'll also be able to see office details. An important call out here is there is additional locations for some of our providers. So feel free to take a look here. Sometimes we have multiple results or maybe closer options that might not pop up on the search first, but is available underneath the provider. So feel free to take a look under that. And then additional provider details. Another call out here is the MPI number is a very easy way to search in our guide search. So if you do have the provider's MPI, feel free to put that in where you'd put PCP, and it will pull up this exact result of the provider if it is in network. All right, now transitioning to our My Health Pays. So this is one of the 2 member rewards that we offer to our members. So this is a quick snapshot of the member portal where they can get logged in. It will be under member rewards and rewards program. So our My Health Pays is unique to Ambetter, something that we're very proud of, and we'd like you to share with all of your members to enroll. They can earn up to $500 in rewards. They can do so by completing specific health screenings or clinical rewards or quality measures to go ahead and earn those rewards. So some of those can include our onboarding and well-being survey. Super simple. Once you have a new member sign up, they can earn points that way. And some other screenings listed there below. So they can earn points by participating in what we hope is fun and easy activities. And then they can use these points to either shop on our online reward store, or what most members use it towards is our healthcare related costs. So they can convert those points into dollars to pay premiums and some other things that we'll touch on here. Like I mentioned, monthly premium payments, doctor copays, deductibles, or co-insurance, they can go ahead and convert these points into dollars to help pay for these costs. The call out here is they cannot use it towards pharmacy copays. They can also use it towards monthly bills. So whether that be utilities, cell phone bills, transportation, childcare, education, or rent. So a lot of options that they can use this program for. My Health Pays is available in all states for all members. So regardless of their age or what state they reside in, they're able to enroll for our My Health Pays. Like I had mentioned earlier, that onboarding survey is very simple for a member to go ahead and get started with us. They can earn up to $50 off the bat for signing up. And then as you can see, some other online activities can earn up to 200, different prevention screenings and health management tools up to $100 and $200. Again, we strongly recommend that all of your members are aware of this program and enrolled in it. Nearly 430,000 members have activated their My Health Pays. As we mentioned earlier in the presentation, we have close to 4 million members. We'd love to see that number go up. Collectively, these members have earned over $26.8 million in rewards. So quite a lot there. Members who do activate our My Health Pays program are more likely to renew, which helps you with your retention for your members. Another one of our member discount that we offer is through Ambetter. So this is going to be under that same tab in the member portal under member discounts. And this program can help members save on home gym equipment, digital fitness classes, healthy eating services, and local gym memberships. Very simple for them to sign up. They'll use the code MEMBERPERKS underneath the registration and can get started saving. Next up, we're going to highlight our formulary list. So a few ways that you can get to this list. One way is through our general website. So under For Members on the Ambetter Health page, you'll select drug coverage, that third option down. It will then prompt you to select the state that you're in. From here, you'll be directed to your state's landing page, and you should see 2024 listed there for the formulary list. It will be a PDF that you'll select and be able to download. Now, it is a very lengthy document, so we do suggest Control F to search by the medication, and you'll be able to easily see whether or not we do cover it. Members also have the option through their member portal to access this information. So under the Pharmacy tab, they'll go ahead and select this, and they'll be brought to this landing page here. So a lot of helpful information here. They have the Find a Pharmacy, drug price lookup. They need to request a prior authorization. They can do so exactly through this Pharmacy tab in their member portal. Now we're going to highlight our virtual 24/7 care and our Ambetter virtual access. We touched on this a little bit earlier in the presentation with the virtual access portfolio. Our virtual 24/7 care is now powered by Teladoc Health. So it is our exclusive provider that we'll be using. And members assigned to a Teladoc, this is a members only PCP on the virtual access plan. Members can choose an in-person PCP or virtual PCP through their member portal or by calling into member services. And again, this is going to be a $0 copay if they're using Teladoc. What's nice for members is they can easily access this through their dashboard as well. So they do have that Teladoc option there. And a couple quick highlights for the virtual 24/7 care. As it says in the name, 24-hour help for non-emergency issues. You can be connected to an expert regardless of the member's physical location, which is nice. Can avoid long wait times at the physician's office and can help reduce the cost of healthcare because it is going to be that $0 copay. Another call out on our ID cards, members will see if they are that virtual access plan. So this will be a purple section on their ID card and will help indicate what plan they're enrolled in. And this will also show for each plan that the member may be enrolled in. So if it's not virtual access, another plan, we will call that out on their ID card. This is a quick snapshot of the guide search. So earlier we searched for a PCP. Now we're showing an example of searching through our virtual access plan. And as we touched on earlier, it's very important your members know that on this provider network, they do require a referral from their virtual PCP in order to see any sort of specialist or in-network brick and mortar. You have an additional call out here, so they can search primary care provider by the two options that are shown above. So they can either go to their Ambetter virtual access, or if they'd like to see an in-person provider, they can do so with a referral. A nice call out here is this does share the same network as our core EPO. So if they'd like to go in person, they can go ahead and receive a referral to our in-network EPO network plan. We have an additional call out here, so we make it very important that members do note they must change their virtual PCP to an in-person PCP, either in the member portal or by calling member services before scheduling an appointment with an in-person PCP. So if you do have any members on this plan, make sure they're well aware of that and how the plan works. All right, we're now going to highlight some of the member communication that is sent out. So as we touched on binder payments earlier, we do send this out to all members. So if you're enrolling any members during an SEP, we will go ahead and get that sent out to the member to make sure that they submit their binder payment. So this will include email, text, as well as outbound calls. And we will do this until the payments have been made or till their deadline for effectuation. So if they enrolled for May 1st, we'll keep sending it until they go ahead and get it effectuated and their plan is active. And we'll also do this for payment outreach for premiums or payments throughout the month. So if existing members are past due on premiums or have not paid their initial, we'll go ahead and send this out on a 30, 60, and 90-day late policy notice to make sure that they're brought current. For new members that enroll with us, so if you're enrolling members doing an SEP, we'll also send out this welcome packet to them. So it'll include their ID card, different call to actions to maybe set up auto pay, pay their bills, choose a PCP. This will typically send out within 7 to 10 days of them submitting their binder payment. So sooner they submit their binder, the sooner they'll go ahead and get their welcome packet. Now I'm going to show you the member portal. So I know we went into detail on the broker portal, but it's important to also know what your member is seeing from their side of the house. So when logging in, they'll have their username and password there. You can prompt members to create a new account if for any reason they don't have one. And we've showcased the member portal dashboard, but we'll go over each selection here in a little bit more detail. So they can easily access our guide through the member portal as well as our national website. They can see who their PCP is, if they have any claims, if they need to order their ID card, it's easily accessed there, as well as that telehealth, which we touched on. The tabs at the top here, they have a lot of helpful tools as well. So doctors, they can, here they can view or change their PCP. So if a member calls, says, hey, I need help changing my PCP, you can easily direct them here to their member portal under doctors, or they can call into member services. The pharmacy tab we touched on, payments we've touched on, so they can easily access this here to pay premiums. Our rewards tab, we touched on our My Health Pays as well as Evenity. Activity and usage goes over claims, benefit usage, referrals, and other plan activity. And then coverage is a nice tab as well because it does show an overview of cost shares and any other supporting documents for their plan. Here's a quick highlight of that medical cost overview. We'll show where they are as far as meeting their deductible. And if they have, we'll show how much they still owe. So this is a nice way to show where a member may stand, whether this be the beginning of the year, end of the year. You can have them go ahead and have this quick sort of snapshot so they can see exactly where they are as far as max out of pocket and meeting their deductible. All right, so a lot of information on this slide, and we went over most of this, so I'll highlight some key points here. But these are the top reasons to sell Ambetter. We are the #1 ACA carrier in the country. We have been for the past 5 years. We cover 1 in 7 lives nationally. Selling in Michigan specifically, it's been our 3rd year, and we're in 32 counties. We have our enhanced My Health Pays program, which you can earn up to $500 annually for those members. Can help reduce monthly premiums if you split it up by $41. And some of the other value-added benefits that we have are Start Smart for your baby. We have health management programs, as well as that 24/7 nurse advice line or teledoc. To the right-hand side, you'll see that some of the highlights for our network, specifically in Michigan. So a nice call out here. We are always working on expanding our network, but see, these are some of the key players that we have. And constantly evolving and looking to grow and add on throughout the year. Next slide, I'll leave this up here as far as contact information. So our broker sales support team is a very helpful team. Please utilize them for any member inquiries that you have. If you need any assistance with broker web support, finding a provider, or contracting follow-up, they will be your go-to team to call. So their number is on the screen there, 855-700-7985, option 2. And they're very responsive via email as well. So Ambetter Brokers with an S at Centene.com. You can go ahead and email them an inquiry. If you do have a member problem or enrollment status that you need looked into, please make sure you include your name, MPN, and then 3 identifiers for that member in order for them to research. Broker sales, the team that I am on, we assist with any currently appointed agents, maybe if you're looking to add on new agents or new states. We can also help with product training, training new agents, and any sort of marketing requests that you may have. You can feel free to reach out. Can also assist with sending any promotional items. If you have any events coming up, I'd be more than happy to get you some sent out to you. If you need to reach our general Ambetter sales inbox, that's on the screen there. So Ambetter sales with an S at ambetterhealth.com. And then that same number to reach our broker team, you'll select option 3 instead of 2. All right, that brings us to the end of our presentation. We'll leave this website up here. As well as our member services team. So this is important numbers, so make sure you have that memorized as well if you do need to access it for any reason. But we thank you very much for your Ambetter support and partnership and all the hard work you do for your members. It does not go unnoticed. I know we have a couple of Q&A questions, so we can go ahead and get to.
Before we do that, can I ask, would this slide be available? Especially the one that shows the hospitals, because we do have a question that centers around finding hospitals.
Sure. Yep, we can. In fact, we do have a breakdown of this. I believe it's in the portal, but if not, I will send it to you, Chrissy or Tammy, and shoot it out to everyone.
Okay, perfect.
All right, so Warren, great question. I do not know, but let me go ahead. I can make note of this and we can follow up with you. I believe that would be in our evidence of coverage. So we can look into that and I can get an answer for you. And Michael, the list of network hospitals. So it should accept hospital as a search term. I'd be happy to send you that link or a quick screenshot of what it looks like. But as Christy has said, we'll get you this sort of breakdown of the hospitals so you have this to easily access because it's helpful when working with members to have that quick spreadsheet or something to look at versus going to the guide search. So we'll make sure we get this to you. And I can also follow up with you and I can share exactly what that term would look like as far as a search on the guide.
Perfect. Any other questions? Well, this was really robust. Ambetter does have some really unique things. I do like the agent portal and all the features that it provides. I have another question, and this came up during open enrollment. I was working with an agent and we have Michigan's got some rural cities there right at the state line where it touches Ohio and in Indiana. And this particular agent had a client who crosses the state line, go and see doctors in Toledo. So this plan was available and the doctor took it in her Toledo network. But the agent could not take the app because it wasn't available, in her address at Michigan. Is there a workaround for something like that? Or how does that work?
Yeah, so all of our EPO or core providers should be able to allow members to visit them, whether or not they are in that state. So if she's enrolled in a Michigan plan, she should still be able to access that. So if for any reason the member runs into that, that's something you could share with me. I could actually reach out to our provider team, make sure they communicate that to the provider because they should be able to see that that provider with no problem.
Well, the issue was that because of where she lived, Ambetter was not available.
Oh, I see.
As an option.
Okay.
Even though it was right next, snugged up to the state line, it's a very rural little city. It was not an option. She had just like 2 options. So I'm not sure how that works. If it's not in that particular county, there's no workaround on something like that. Is that correct?
Yeah, that's right. So to my understanding, if they're not in any of the counties that we offer coverage, we couldn't enroll them there. Unfortunately, I wish.
Yeah. I mean, obviously that's what it came down to, but she really wanted to keep her doctor, so she was being forced to obviously choose a different doctor. But I don't see any other questions. So let's see here. Yeah, so Shannon, thank you so much for taking some time today. We appreciate it. This was really good. And we will be following up with all of you that were on this today. Either myself or Tammy will be calling you and just checking in and finding out, if you're already appointed with Ambetter or if you want to get appointed, we'll get you going.
Yeah, and I'm happy to assist with any other questions. Feel free to follow up with me. I took a screen grab of the 2 questions, so I'll follow up with those agents. But
awesome.
Yeah, thank you everyone for your time. Hopefully this was a good sort of dive into Ambetter Health and our plans. And again, we greatly appreciate all of the hard work that you do for your members. So please feel free to reach out to us with any questions. And we're looking forward to a good SEP and into OEP.
Right.
Before we know it.
That's right. Okay. Thank you so much.
Okay. Thank you.
Bye, everyone.